Hi everyone. The topic that I chose to discuss today is regarding the long-term benefits of behavioral therapy over medication for children with ADHD. I want to share a little bit about myself. I have a 6-year-old son who is very energetic, full of life, loves to be very active, and is full of imagination. While at this age, this is very common for children to play and be active and play all day, it poses some behavioral issues for my son in class. He is really distracted and he has difficulty focusing and following directions, and he is very impulsive as well. These symptoms are a sign of ADHD. So let me explain to you a little bit about what ADHD is. ADHD is a behavior where children act without thinking and they're very hyperactive. And while they know exactly what's expected of them and what they need to do, they have a difficult time being able to control that because they aren't able to sit still and they're not able to focus on the details. So there's many things that affect children with ADHD. Some of the things that they struggle with is time management, short-term memory, prioritizing, and sitting still. While these are the downfalls, there are some positive things for children with ADHD as well, which is problem-solving skills, adapting to change. They're very good at that, and thinking outside of the box, as well as taking risks. So children with ADHD do have some skills that they can turn into positive ways of behaving, and that is usually practiced with behavioral therapy. So I'm going to talk a little bit about both things and how they work. So with medication, what happens is doctors give the children stimulant type medications, and these medications are called Ritalin and Adderall. There are different types of medications as well, depending on the strength needed. They help by reducing the child's activity level to a normal class setting, to where they can behave in class. And the effects are very quick. The only problem is that they're only temporary, and that's where it poses a bit of an issue. In an article that I found by the scientificamerican.com, written by Sky Curious on May 15, 2012, it says that as of 2007, 2.7 U.S. children and adolescents with ADHD were immediately being treated with medication. And new research has found that medication hasn't really turned out to be the solution that they thought it would be. So the problem also with medication is that there's a lot of side effects. And some of the side effects include personality changes, there's depression, there's, difficulty with them sleeping, and they also have an increase in their appetite, so that also results in weight gain. And these side effects basically end up creating other issues where you have to take other medications and do other things in order to correct those. And the doctor ends up playing with the medication with the child to find what the right thing is. And there's basically no set formula for what is needed or what works best. It just basically ends up being a process of trial and error. So there are some positive results with the medication, and some of those positive results is that, it immediately improves impulse behavior and it helps the kids pay attention and remember things, but again, it's only temporary. So when the medicine wears off, those effects or that behavior is still there and they still have to work with that. And so what happens when the child's not on the drug? What do they do at church, or what do they do at home, or while they're at the grocery store? Well, that's where behavioral therapy comes in and how it can help with those types of situations. And what basically behavioral therapy is that there's learning specialists that help parents and children learn a variety of strategies. They teach parents different types of skills to be able to work with a child with ADHD. It reinforces positive behavior. It helps structure time. It also helps teach them how to have routines, and also for the parent to give the child positive attention. It really helps for the child to have positive attention when they're doing good, to keep them going and keep them motivated on, the good behaviors. So, in an article that I also found by AttitudeMag.com, William Pelham, PhD director of the Center of Children and Families at the State of University of New York, says that a child can take medication for 10 years, but the day you take them off of it, the benefits end up stopping, and then what happens? It makes it really difficult for you to be able to help a teenager than it would a child starting from the beginning with the behavioral therapy. And it works best when you start young. So, the benefits of behavioral therapy are that it helps in reducing impulsivity, it helps reinforce the long term positive behavior, and it also teaches interventions and techniques for the child to manage their school and their work and responsibilities. So, it really helps a lot to just start when they're very young. And so back to the medication and how it helps. It is a quick fix and it is a lot cheaper, but it just does not provide the help that they need long term. Medication also, doesn't cure ADHD. It's just basically reducing the ADHD problem. So, not all children will respond to the therapy by itself, and sometimes you may need some medication to help out with it as well. But it's best to start with the behavioral therapy first to see how far that takes it, and then you may not need the medication. And what we're really looking for as parents is something that lasts a bit longer. Something that in the long run you'll be able to help your child succeed and receive long-term results in their life, with their work, and in relationships in the future. Thank you.